So welcome everyone, and thank you for joining us today. We will explore how automation is transforming pediatric oral health and helping dental professionals improve patient compliance, enhance brushing effectiveness, and drive better long-term outcome. I want to introduce Dr. Christina Carter, who will be leading the webinar today. Dr. Christina Carter is a pediatric dentist and orthodontist with dual certification and expertise in treating patients of all ages, including those with special needs. She has a private practice in Madison, New Jersey. She's also an assistant professor at NYU College of Dentistry and a board member of the NYU Oral Health Center for People with Disabilities. Named a top doctor by New Jersey Magazine and a favorite kids doctor by New Jersey Family Magazine. So it's our honor to have her today to talk to us about automation and how it's unlocking better pediatric oral health. Welcome, Dr. Carter.
Thank you. I'm very happy to speak about Willo. We know that getting children to brush their teeth, brush well, and do it the right amount of time is always a challenge. So we are going to discuss definitely and review the need for it, but also talk about what are those barriers and talk about how the role of animated toothbrushes can really make a difference. And Willo, we've all seen so many different toothbrushes that have come in my 25 years. I must have seen multiples of that on electric toothbrushes, but this one really works. And that's why Willo is different. So we know that children can't, don't, and won't brush their teeth properly. And dental cavities are totally preventable. However, it is the most common chronic disease in children, and over half of children have cavities, and it's preventable, and it's really a shame. And it's an epidemic. 15% in children 6 to 11 do not have those cavities treated, and 13% over 12 do not have them treated. But over 50% of our children have cavities. And it costs our system and healthcare a tremendous amount of money, over $10,000 per child. So we always say they can't, don't, and won't. So children report skipping brushing 20 times a month. And even when they do brush, it's not for long enough. Now, 2 minutes can be hard for some adults to brush, but for children, that's an eternity. So we're lucky if we get 30 seconds under the age of 3 to 5, and then 35 seconds under the age of 8, and even up to 11, still under a minute. So we need to find a better way to help children be motivated, to do it right, and to do it for the right length of time. So we started with a toothbrush, the manual toothbrush, and children usually chew it more than anything, and they move it around. And even when we say brush your teeth, it's really an ambiguous command. It's hard to get all the surfaces. It's hard to get all the teeth. Sometimes they just do the middle of the back teeth. They rarely get the front teeth. So then we went from a manual toothbrush to an electric toothbrush. And that made a better sweeping motion, but you still need to put the toothbrush in the right spot, but you also don't brush at that case. You just put the toothbrush next to each tooth. So it's even a different motion than we've been harping about before. So there's a lot of confusion. So the Willo fully automated toothbrush is a U-shaped piece that when placed on the teeth, everything works together and you just need to hold it there. And it's actually fun. So what are the barriers? Children really don't have that much manual dexterity. Parents will ask me, at what age can I let my children brush their teeth on their own? We used to say, not until your child is able to tie their own shoes or write their name in script. And both of those tasks now are not exactly benchmarks that every child is going to hit. So we know that they don't have that manual dexterity until the age of 10. They also don't have enough attention span, and it's even getting shorter with all of our electronics to really brush for a minute. The concept of time is not developed, and that's just how their minds are. They don't really have that executive functioning skill yet. And then that whole proper technique takes a lot of skill. Again, adults struggle with that, and here we are asking younger children to be great at it, which is not possible. So how can we revolutionize this? How can we make it fun so they want to, they can, and they do? That's where Willo comes in.
Cool, but won't it lead to lazy brushing? Listen, being a kid leads to lazy brushing. They can chew on their toothbrushes for 2 minutes twice a day, but is that really cleaning their teeth? The Willo Autoflo Plus is just so easy to use, which means that they're actually getting the clean they need. It's something that my kids look forward to doing because it's cool and they can use it independently. Willo actually brushes their teeth correctly for the correct amount of time, which is helping them build healthy habits and learn to love that freshly clean feeling. Willo is not only helping them learn to prioritize brushing their teeth, but also making sure they get a proper clean in the meantime. It's a win-win. Learn more at willo.com.
So let me tell you about Willo. Willo is revolutionizing pediatric oral care. The Willo Autoflo Plus automates brushing, ensuring every tooth is cleaned thoroughly and consistently with no additional effort required from the child. Basically, place it and it's going to do its job. It has advanced brushing technology because the OptiClean brush head has 34,000 optimally positioned bristles, which covers every tooth in a consistent amount of time. So it's moving things properly. It is an effortless, mess-free experience. With just one push of the button, Willo dispenses the perfect amount of toothpaste that uses continuous suction that removes the liquid throughout the brushing directly into the sink. There's no more mess. It's not like a water pick. You don't have to do it in the shower. It keeps the countertop and the mirrors clean. And the interactive app keeps kids motivated and rewards and countdown timers while allowing parents to track brushing history. As much as we don't want our children to be inspired and motivated by our electronics, it's the way it is. So if we can't beat them, join them. And it provides peace of mind for parents and professionals. It ensures the proper brushing technique and coverage every single time. It reduces the need for supervision and improves long-term oral health outcomes. So when our children become super independent and they don't want us in the bathroom for privacy, we know that they're brushing properly, effectively, and they're actually doing it. So how does automation deliver better results? It's that consistent position, the brushes move properly, and we have the set amount of time. And because we're trying to be that, and we are the best brushing technique, we know that it is effective. We're getting all around the mouth, all the surfaces, and we're using the right amount of toothpaste. There's no worry about a child under the age of 6 struggling to spit out because it's all taken care of. Basically, it's the easiest thing around.
Willo Autoflo Plus works by combining ease and effectiveness. Once inserted, a simple tap of the button starts the fully automated brushing experience. Water and Willo toothpaste begin flowing directly into the OptiClean brush head, fully surrounding teeth. Willo's gentle sweeping motion guides the innovative angled bristles over every tooth, cleaning every surface and those tricky, hard-to-reach spaces between teeth. Plaque and debris are consistently and thoroughly removed during each brushing cycle, and liquid and debris are seamlessly evacuated into the sink, making brushing virtually mess-free. The process repeats after flipping Willo Autoflo Plus to clean the bottom teeth, providing an effortless and effective dentist-recommended clean every day.
I'm not sure if that sound was working, but here we go. So what is the difference? We all know that manual toothbrushes, it's really hard to get that bristle in the right position. And it's the same thing with electronic toothbrushes. That consistent motion of the toothbrush is not done by manual, but electric does do it, but it doesn't put it on the tooth. And then doing it consistently during the time, only an electric does that. But the precise application, Willo is the only one that does that and all of these 4 things. It's truly a comprehensive system. So does it actually work? Plaque studies are really the best way to show this. And we have proven that the Willo is 7 times more effective at removing plaque in hard to reach areas. And you can see on the right-hand side how the teeth really are beautifully clean after using it. And we've reduced it by 60%. Who doesn't want that consistency every time they brush? And we can see by our charting just how much more effective it is. So taste is always an issue, and texture for our patients, especially those with special needs. So the toothpaste in Willo is excellent. It comes in a berry, a bubble, and a mint, and it's kid tested, kid approved. It's SLS free, which is key for many of our children with oral sensitivities. We have a fluoride and a fluoride free option for those mothers that do not really want fluoride, even though it's recommended by the Academy of Pediatric Dentistry and the ADA. And so it flows through this toothbrush and gets in all those nooks and crannies. So our children are super motivated by technology, and parents love to know what's going on. So not only do we have a way to track it for children, it reports directly to the parent. It's a great report card that keeps that did you brush, did you brush, did you brush dialogue out of the house. It tells how if the child did it and how well they did. And this report card is beautifully motivating for children. They earn icons and there's graphs, and it's really fun. And it reminds them that they need to brush as well. So this engaging reward system is beneficial for all. So how is this brush different? It's in 3 different sizes for ages 5 to 7, 8 to 11, and 12 and above. And it's the right size for each mouth. And the right fit allows for effective cleaning and great brushing. It's comfortable, it's effective, and it's easy. So in summary, pediatric patients have a problem with cavities, and it really can stunt their growth and development, and it's one of the major reasons that they miss school. Cavities are entirely preventable and treatable disease, and is the most common disease. But effective plaque control and establishing effective home routines is the best way to provide a wonderful preventative oral care environment. And automation by Willo is revolutionizing healthcare. And this automated toothbrush allows the teeth to be cleaned in all angles. Toothpaste is appropriately dispensed. You don't need to worry about eating or drinking or snacking on it, which some children like to do. It's totally safe. And Willo is the first automated toothbrush that is leading the way, and it's proven to truly make a difference.
My name's Ella, and I don't like to brush my teeth. I'd rather be playing with my brothers. Whoa. You put it on your teeth, you press a button, and it brushes it for you. It makes brushing my teeth so much easier. I can do it all on my own.
Willo, brush healthy, brush happy.
But we see consistently by all of our patients that use it. We've tested it in my office, and it's kid tested and kid approved. If not, I'm going to send you to willo.com, 1W, 2 L's, dental professionals. You can follow us on Facebook, Instagram, at Willo Cleans. It's a great new adjunct for your office, and it's not just another one of those widgets that we see in front of us. We have studies to prove and beautiful, healthy smiles to show how well Willo works.